Hi, this is Desai and Gülsün presenting on behalf of Team Flossen and Bossen. Our advisor is Dr. Adriana Segura. Our team members are Drs. Shandra, Desai, Gülsün, Elizabeth Hamilton, Radd Lukas, and Conor McCollum. Our study focused on comparison of chair utilization rates in dental schools by scheduling method. In our study, we looked at our 6 dental schools that we represent. We compared various methods of appointing patients and the effect of the scheduling method on the chair utilization within our institutions. The 3 types of scheduling systems that we looked at were those administered by staff, those where the students made their own appointments, and others where there was a combination of students and staff making the appointments. The parameters we looked at were chair utilization, which is the appointment slots which were utilized and completed, and the open chair time where no patients were scheduled. So we have some background information on our 6 schools relating to the scheduling methods. At the University of Alabama at Birmingham School of Dentistry, the students schedule their own appointments in the system Salud. Patient coordinators are responsible for assigning the students a chair. There's morning and afternoon sessions, and the study was specific for the comprehensive care clinic. At the University of Maryland School of Dentistry, students schedule their own appointments in Axiom. There's 3 sessions per day, and again, the students are assigned a chair by a staff member, so they may book about 6 to 8 sessions per week. At Midwestern University College of Dental Medicine in Arizona, the patient account representatives and practice assistants schedule the appointments. The students work together in pairs of D3 and D4 students, and they schedule using the Axiom software. At the University of Pittsburgh School of Dental Medicine, schedulers or patient experience specialists schedule for the students in small groups. The patients can either call or make their appointment while at the dental school. At the University of Texas School of Dentistry at Houston, the students schedule their own patients in Axiom. There is some guidance over what procedures are approved, and they require faculty approval. At Tufts University, each discipline has limits on how many appointments can be scheduled. The students submit an appointment request to the scheduler, which may be fulfilled if there is space and faculty coverage available.
Our study objectives have 2 aims. One is to assess which method had greater chair utilization. The second was to assess any barriers and limitations to any of the scheduling methods. Our materials and methodology. Our chair utilization rates were compared for the months of October 2018 and April 2019, only 2 months. The method used to calculate chair utilization was tabulating the number of completed appointments compared to the numbers of available appointments made, if also collected by the school, and compared to the capacity of the chair slots for that time period. Our first table is our descriptive table. It shows the characteristics of the dental schools. It shows the number of students, number of chairs available, and also who does the scheduling from students to patient account representatives, patient experience specialists, DPAs, or practice assistants. Only School of Alabama has the system Salute. The rest of the schools have Axiom. Our second table shows the characteristics of chair utilization per dental school for the months of and the year of October 2018 and April 2019. If you look at the total number of slots available by chair, the minimum numbers were for Alabama School, and the most numbers belong to Tufts Dental School. We also have the number of appointments made because Alabama didn't have all the numbers available. Therefore, for the graphs, we took the Alabama out of the assessment. We look at the appointment realization rates, chair utilization rates. You also, on the last column, you see the lost appointments. Our comparative graphs shows for different time periods for 2018 and April 2019. There's a significant change in the Midwestern's appointment realization chair slot utilization rates, Midwestern and Pittsburgh, and a really high peak for the Tufts on April 2019. These are all the variables or varieties or variances are dependent upon the differences in the students' schedules and coming to the clinic times as well as the graduation time periods. So in our discussions, we can say that out of 5 schools, the average appointment realization, which means appointment kept versus appointment made, was 85%, minimum 69 till maximum 95% in 2018 in October, versus 88% in April 2019. The average chair slot utilization, appointment kept versus chair slot available, was 67%, which is much lower in 2018, and 69% in 2019. This might indicate that our appointment scheduling systems are working because we have 80% show-up rate for the appointments we made for our patients, which means appointment realization rate. However, we underutilize, some of us more than others, our capacity, which means total number of chairs that we can utilize. This means that we have chairs available, but we're not utilizing them properly. We can also see different in rates when students are new to the clinic, not having enough patients or very hesitant to see the patients in a fast manner in October 2018 versus time near graduation, as I mentioned before, just before the graduation when they need to complete their clinical requirements, as we see it in April 2019. So due to these underutilization of capacity, we might look into issues that dental schools face. We pick 2 issues. One is to matching the patients or the relatively appropriate patients to the student needs. And the second issue is having enough number of faculty on the floor relative to the procedures scheduled for that patient. Luckily, one of the schools, Columbia College of Dental Medicine, already created an algorithm that matches the certain patients to the certain procedures as well as the certain students that needs to those patients. So with this kind of algorithm, they are able to provide an efficient, fair, and consistent matching process. In our conclusions, we can say that all schools showed multiple open chairs and areas for improvement in chair utilization, but the student mixed staff and student teams scheduling, or the way of scheduling, seems to be the most efficient. It's probably likely to due to the collaboration amongst the student staff team in the clinical operations arena. It's mostly student driven, but there are also limitations of the study. As we observed, we only reviewed 6 schools. We only compared 2 time periods in 2 different different years. Only reviewed pre-doctoral and comprehensive care clinics. We can look at the different schools and clinic policies. And also there is a difference between or among our student rotation times. Our next steps, we would like to expand upon our findings. For example, we can do this or expand this study to the more schools or more months. We can compare the chair utilization rates for postdoctoral or any other specialty clinics. We can also compile our findings for suggestion of best practices. we can consider how chairside technologies, artificial intelligence, machine learning technologies can help design efficient automated scheduling systems, such as the Columbia School that they used, or they created an algorithm. Thank you very much.